Good morning, everyone. Bonjour tout le monde. It's a pleasure to be here this morning and to make an important announcement. And happy Canada Day to everyone. C'est un plaisir d'être ici ce matin pour faire cette annonce importante. Je vous souhaite aussi une bonne fête du Canada. As I've said in the past, COVID-19 has affected every Manitoban. No one has been unaffected by COVID-19 in Manitoba. And COVID-19 put a lot of people's plans on hold. I just have to think about yesterday and the fact that it was a very different way for people in our province and across the nation to celebrate Canada Day. You didn't see any of the normal types of big outdoor gatherings. There were no large fireworks displays, big concerts and events to attend, no large groups of people assembling. But it's different, and we will get back to normal, but yesterday was not that day, and today is not either. It's also been a difficult time for anyone who had to have a surgery rescheduled because of COVID-19. And I want to thank Manitobans who are on those lists for their patience at this time. Cela a été une période difficile aussi pour ceux qui ont dû reporter leur chirurgie en raison de COVID-19. Et je tiens à les remercier pour leur patience pendant cette période. On March the 12th, Manitoba first announced our first presumptive case of COVID-19, and as of March 16th, elective surgeries were suspended. Many factors went into that decision. The rationale to suspend all elective surgeries was to maximize the efficient use of staff, of beds, of equipment, and of PPE, personal protective equipment. Staff wanted to be able to abide by the principles of social distancing and limit the possible transmission of the virus in their workplace. There was considerable attention given to staffing issues associated with possible self-isolation by infected staff and childcare needs due to daycare and school closures. We needed to preserve acute care capacity for an anticipated surge of COVID-19 patients admitted to hospitals and intensive care units. And of course, concerns were also raised by the Canadian Blood Services about reduced blood donations and the resulting impact on blood supply. And throughout this period, of course, surgeries did continue. Surgeons were given direction to delay any cases that could safely wait 90 days. Surgeries that were deemed to not be able to wait for that period of time did continue. Approximately 7,000 elective surgeries, procedures, and activities were canceled across the province due to COVID-19. Manitobans have done their part. They've stepped up. We have flattened the curve. We have limited the spread of the virus. We have some of the lowest case positivity rate numbers in all of Canada. And because of that, on April 24th, we moved to restart our elective surgeries and other non-urgent health services. I can report to you today that as of June the 10th, surgery volumes had gone up to 90% of pre-COVID activities. As of June the 10th, there were still approximately 5,500 patients awaiting surgery. So today, I'm pleased to announce that our government is issuing a request for proposals to complete elective surgeries postponed from COVID-19. Aujourd'hui, je suis heureux d'annoncer que notre gouvernement publie une demande de proposition pour compléter les chirurgies électives reportées en raison de COVID-19. Our government is looking for innovative solutions to ensure that Manitobans get the surgeries that they need. And we believe that this plan will get people the care that they need as quickly and as efficiently as possible. Proposals that are put forward as a result of this solicitation for bids will present details on how the applicants or the group will be able to address priority surgical and diagnostic areas by creating additional capacity in our system. The proposals must also consider and identify how services can be provided by meeting all required legislative, regulatory, and standards requirements, including regulatory body licensure requirements for health providers. And in addition, the proposals must not affect existing service delivery capacity in the public system. Services must be able to be delivered beginning August the 1st. I've been speaking to colleagues in other jurisdictions, and I can tell you that other provincial ministers are proceeding in similar directions. Similar processes are appearing across Canada. The Manitoba government already works with a number of providers outside the public system to provide more services, including cataract surgeries and other surgical and diagnostic procedures. This request for proposals will help us to use more capacity in the system. Healthcare system capacity, capacity by our independent providers, and capacity by private providers to put the focus where it needs to be on ensuring that people have access to the care that they need now while the risk of COVID-19 is lower. Cette demande de proposition nous aidera à utiliser leur capacité pour assurer que les gens ont l'accès aux soins dont on a besoin maintenant, alors que le risque de COVID-19 est plus faible. Let's all remember that we're not out of the woods yet, and although the numbers look good in Manitoba, we believe there is a window to act right now, and that is why we are proceeding rapidly. We don't know what the fall will hold. We don't know what the winter will hold in terms of a possible resurgence of COVID-19. So clearly now is the time to get to work. Now is the time to address the issue of the backlog of surgeries that were created as a result of COVID-19. And now is the time that our government is confident that this plan will get Manitobans back on the road to their own recovery so that they can start making plans in their lives again. Thank you, everyone. I'm happy to answer questions now.
Thank you, Minister. We have a number of reporters on the phone and two in room 68. Today, we're going to start with reporters on the phone. Please proceed.
Hi, Minister. Colin Clark from the Brandon Sun here. I was just wondering if your government has any concerns that the flooding in West Van with people gathering together to work on disaster areas and whatnot, do you have any fears that that will spread COVID-19?
I've been receiving updates and briefings as a result of the significant rain event that occurred in Westman just recently. And I can tell you that while there were concerns at one point in time that certain facilities might need to undertake to do some evacuation planning, I can tell you that's not the case right now. That even though it was a significant event, including the flooding in the Brandon Regional Health Center, that it is back to business, that activities are continuing in places like Minnedosa, in places like Rivers, including Brandon and Neepawa. I do want to thank all of those who responded in that region. Heroic efforts, many people working hard throughout the weekend to address the result of that flooding. And we thank them for their work. I think as a result of that hard work, they were able to mitigate a lot of damage. I have heard no expressions of concern that somehow this event might lead to a COVID-19 increase.
Thank you.
Minister Stephanie O'Suquith, City News. Just wondering, how much would the average Manitoba who is waiting for their surgery expect to wait with all the delays? Like, what is the timeline for them?
So That's difficult to say. Thanks for the question, because surgeries and procedures and those activities are scheduled partly on a first come first serve, but also on the basis of need and acuity. So it can be difficult to point out exactly how long someone would wait. Clearly, whatever province you live in, people are waiting longer because of the backlog created while system leaders sought to clear activities to prepare for COVID-19. Our challenge right now is twofold. We must bring activities back online in our conventional system, but that is not enough, because even right now, we've gotten back up to 90% of COVID-19 activities for surgeries and procedures, but that even then, we are somewhat limited right now in terms of getting up to 100% because of the availability of PPE, enhanced infection control and prevention techniques, enhanced cleaning, the need to keep people safe and distanced. All of this takes some time and effort, and that time and effort pulls away from activity. However, all of that is only one side of the coin. On the other side of the coin is the need to actually address the backlog. Even getting to 100% won't address the backlog. That is why we need to act with innovation and creativity, and we believe that this solicitation for proposals will be exactly a means by which we get people thinking creatively about what they can do to add additional capacity to make that wait time less.
Hi, Aiden from CBC News. Minister, I'm wondering, can you be more specific about what you're hoping to hear from providers? Like, are you hoping to hear from people who can perform surgeries, private facilities that can perform surgeries, or places that think that they could take other responsibilities on so that others could perform surgeries? I'm just not clear on what you're looking for.
Sure. So thanks for that question. It's a great question. So I would say that this request for proposals and this request for supply arrangement is designed to solicit from groups that ability to bring online, to propose back what they could do for same day, for outpatient procedures. So this is not for people who would need to be admitted to a hospital. So I would suggest that it would be for lower risk procedures, but it could take up things like pediatric, dental, pediatric ENT, other ENT, general surgery, cataracts, outpatient spine procedures, adult general surgery, echocardiography. These are some of the areas which we're looking to identify with this call for proposals. And then essentially, instead of buying slates, we're looking to purchase procedures. But it's not limited to private providers. This is broader than that. This is looking to solicit anywhere within the system, from health providers now in the system, from independent providers, and from those private providers who also provide activities right now in our system. It's an all-hands-on-deck approach to be able to add more and then to think strategically about what is the best thing that could provide to create capacity in our system, bring down the wait times, and allow more people to get their surgeries and procedures sooner.
Marty from Global News. Do you know how many private or independent surgical centers there are in Winnipeg or the province that would be able to submit a proposal?
So again, I'll just indicate as well, though it's not limited to private providers. This is a solicitation whereby we could have surgical teams at regional health authorities, in hospitals, provide back a plan of how they could augment what they're doing now. There could be independent hospitals in our system, like St. Boniface Hospital. We could have teams there say they want to participate. And then, as you say, also extending to other providers of healthcare who operate right now in our province, including privates. And right now, of course, there would be those two private providers that most Manitobans are familiar with. And we're asking all of these groups to say, who has the experience, who has the ability to deliver, what is the value of the solution that they're proposing, and what is their capacity to act on the timeline we need. So as of today, that will be posted on Merck's, and we believe that there will be significant interest in this. I would want to be clear that this isn't prescriptive, it's invitational. We are asking Manitoba providers of healthcare to use their expertise, to use their knowledge of their craft, to ascertain the capacity of their teams to provide additional capacity in our system so that all Manitobans benefit.
Minister Friesen, Diana from 680 CJOB here. I know you said that there were still 5,500 people waiting to have their surgeries rescheduled as of early June. Has that number changed at all? Where do we stand now?
Yeah, it's about 5,500 right now. So we've had some success in working down that list, but obviously, as you can see, we've got a lot more ground to cover. We are moving ambitiously in respect of this RFSA, this request for supply arrangements, to be able to post now, to close this contest in a week and a half, to adjudicate in a big hurry those proposals that we receive back, and to award this work so that these activities are commencing already in August. We would believe that for the purposes of this engagement, that work could continue until March the 31st. However, as I said, we don't know what COVID-19 holds. So if all goes well, these should be additional activities that can complete by March the 31st, and that would have the effect of reducing by another 2,500 those procedures that people are waiting for.
Good morning.
Winnipeg. Just switching gears for a second, some Toronto and other that recently passed law for mandatory masks wearing indoors, and some other communities are following suit on this. Will there be any discussion in Manitoba for making for similar mask wearing policies, making it mandatory to wear masks?
So as health minister, I speak directly and often to Dr. Brent Rusin, the province's chief provincial public health officer. And I believe Dr. Rusin has been clear on this issue that some people are wearing masks because they want to. Some people are choosing at this point not to. Dr. Rusin has continued to, I think, clearly say to Manitobans that the best things that they can continue to do to prevent the spread of the virus is to stay home when they're sick, is to wash their hands often, is to continue to distance themselves from other people, to follow the rules, to not engage in large gatherings that would contravene those guidelines that are in place. Those are the best things we can do. I also hear from public health experts that a lot of people want to wear a mask, but they wear it incorrectly. Or they wear the wrong kind of mask. So I do see people walking around, some wearing masks, some not. There is no provision or guideline in place right now in Manitoba that would stipulate the mandatory wearing of masks.
Good morning, Minister. I'm here from Radio Canada. I was wondering if you, regarding the decision to open up to the private sector to provide health services, have you been talking with unions? Maybe because it can arouse concerns from them and to open up to bigger, more to the private sector. Have you talked to them?
I'm missing part of the question. Your audio feed is a little bit muffled. Could you just repeat the question one more time?
Oh, sure. And if you could answer to me in French, that would be great. Just wondering if you have been talking with unions, because opening up more to the private sector could arise more concerns from them. So I was wondering if you were ready to answer those concerns and maybe some criticism from them.
Yeah, well, nous continuons à discuter toutes sortes de choses avec les unions, avec Labour, ici à Manitoba. Mais pour cela, pour cette chose que nous commençons à faire ici, non. not particularly. I would just want to reinforce that we continue to speak with labor on a broad variety of issues, but we believe that that labor wants what we want in respect of Manitobans who are waiting for these surgeries, and that is to have a better, more speedy access. I think that what labor leaders will appreciate about the approach that Manitoba is taking, and I would reinforce that some other provinces are taking this approach too, including BC, is it's a solicitation for partnership. It's a team approach to problem solving. This is not a prescriptive approach that says you shall provide these services. Instead, it's going out to solicit for ideas. We are asking for ideas. Nous demandons pour les idées. And on the basis of that, we believe we will be able to do well. Think, for instance, where we may even have in our hospitals right now surgeons and surgical teams who are providing surgeries and doing that in full slates. Well, maybe there's going to be the ability, when they think about how we're describing this opportunity, to extend those slates, to maybe not do double slates because that would be wearisome, but to extend those slates and take on other activities. If the system doesn't ask for that kind of innovation and creativity, we won't get it. So we're undertaking to do that in a creative way, but also, as I said, in an invitational way, in a cooperative way. We believe that labor will appreciate that approach.
Thank you to our reporters on the line. We'll go to the floor now.
Somebody who might say, oh, this is a slippery slope, you're going to start with RFPs now, but once the pandemic is over and March 31st is over, what's to stop the province from continuing to offer, private firms more opportunities to do surgery? Or is there any reassurance you can give to people that this isn't, a slippery slope to the privatization of healthcare?
Well, to be clear, right now in Manitoba, the way that people receive their health care when it comes to these types of surgeries and procedures is a broad array. Sometimes in a system-owned facility, sometimes in an independent facility that provides services to our system, and sometimes, and for many, many years in this province, a private-owned facility that provides those services. Many Manitobans will know that they received some ENT procedure, a cataract procedure, a general surgery procedure in a private facility. So our system is a broad array of providers. However, I would say this, people can always have that assurance that all of these are in compliance with the Canada Health Act. These are insured services paid for by the government, not paid for directly by the public.
Do you know how much trying to catch up with this backlog is going to cost the government? Is there any kind of predictions on that?
Well, we know that nothing on COVID-19 response comes cheap. But of course, I would want to be clear that there was funding in place for these procedures. These procedures lapsed because of a need to prepare our system for COVID-19. So there is still funding in the system. However, Manitobans would be quick to point out to me that, of course, that funding has been reallocated in a broad variety of areas. Our expenses we incurred in healthcare in this province were very considerable. For PPE, to get the equipment that we needed, including ventilators and many other pieces of equipment, other supply, human resource in health, and many other areas of incurred expense. So it will cost money, and of course, because we have an RFSA that is hitting Merck's just today, I won't speculate on how much we believe it will cost, but we know what procedures cost, and so we know that people will sharpen their pencil and they will come back and they will want to be competitive as they help us to address the challenge that is before us all.
You said you want to, by March 31, reduce the number on that backlog by 2,500. Is that the number of procedures that are potential outpatients, or is that just the overall goal for reduction?
So this goal of 2,500 is a significant goal existing out of this 5,500 remaining backlog. So a few things. First, of course, we have been successful in helping to ramp up those surgeries and procedures to pre-COVID-19 limits. We thank everyone in our healthcare system for being part of that solution finding that's going on. The second part of this would be we're asking more of our system planners. We're asking for creativity and innovation on the part of system planners to see how we could even augment in our system more. And then beyond that, then this solicitation is now proceeding where we will attempt to also address another 2,500 procedures. The limiters are still there. There are some limiters. We don't know where we will be on COVID-19 in a few months. But, you know, think of this as being, we've come up to periscope depth. We dove during COVID-19. We are at periscope depth now. This allows us to do some things. We can see the lay of the land. We can get our bearings. We believe that now is the time to act. And there may be the ability to go even further than what we've scoped out here. But like I said, this is an aggressive timeline, an aggressive proposal, because we need to be aggressive in respect of the window that is right now presented to us as a result of Manitoba's good numbers and continued low case positivity rate to make progress and reduce those surgeries.
I understand there's no formal contract with Morneau-Chapelle for the mental health services provided during the pandemic. So how did you come up with the $4.5 million arrangement with that company? Was it, what kind of agreement was there? Apparently there's no formal contract.
I believe the contract is in place.
Where is it? Because there was a request made for it and it was not available according to the...
If a request has been made, then there'll be a process in government by which that request is received, and then people undertake to ascertain whether the information is available to release.
Okay. And have any Manitoba clinical psychologists signed on to help provide services, do you know?
I believe they have. I believe that built into the contract was the ability as well for Manitoba providers to come on and to assist with this work. I will go back to check on the number of Manitoba providers. We had to act with haste in respect of the very significant engagement that we made with Morneau-Chapelle to provide this online virtual access to care for an unlimited number of Manitobans. And the last I checked, it was thousands of Manitobans who had availed themselves of the ability to receive these services online. We're very proud of this engagement. We were the first province to say, listen, COVID-19 has a very dramatic, real, and demonstrable effect, a measurable effect in the lives of people. And then there's that effect it has that is less easy to measure. And that is the part on our psyche, on our mental health. And the impact there is no less real. Anxiety, fear because of the disruption, being cooped up in your dwelling place for months, not allowed to go and do the things you'd normally do. So we're very proud of the engagement. We're very proud to know that so many Manitobans are receiving this help that they need. And I believe that built into this engagement is also the opportunity for Manitoba providers to also provide services.
We have time for a couple more questions. We'll hop back to the phone for any final questions for our reporters on the phone.
Once again, I'm
wondering if this announcement just is another way to bring in more privatizations in Manitoba's healthcare system.
So this is about solutions. It's about being innovative. Let's be clear. Right now in Manitoba, we have that array of system capacity, independent provider capacity, and private capacity. That's been here for years and years and years. All governments of all stripes have engaged with these groups. And in all provinces, these groups are engaged. This is not some kind of departure from anything that's consistent with the Canada Health Act. This is simply commissioning for services. The difference, I would say, is that we're tendering for it. So along with this tender then comes accountability, transparency, and the ability to hold those delivery agents responsible for the work that they say they're going to do. As I mentioned before in my notes, it's all in full compliance. It must meet all licensure requirements, all legislative requirements, all regulatory requirements. So our government is agnostic when it comes to who's providing the service. But let's be clear that even in respect of this engagement, we may very well have our conventional hospital teams coming back and saying, we can do this, and we know how to add more capacity to the system. We're about results, and we intend to get results as a result of this engagement.
Regarding the situation of the CEO of the St. Boniface Hospital, I was wondering what the government could say about this and how things can make. How did you make sure that things were going to run smoothly while you were away?
I'm sorry, I'm still with your audio.
Again? Can you hear me?
I can hear you now.
Okay. I was just wondering what the government could say about the situation of the CEO of the St. Boniface Hospital, who is in Quebec since mid-April, and how things were assured that how things were assured that the hospital was running smoothly during the COVID-19.
Thank you. I understood the question this time. Even before COVID-19, it's no secret to Manitobans that we've been taking on some of the most profound changes in our healthcare system over the last 2-3 years that we've seen in 50 years. And they were changes for a reason, because we knew that our results trailed those of other jurisdictions. They were changes that were designed to get better health care sooner for Manitobans. It's been a time of immense transformation, and nowhere more than in the Winnipeg Regional Health Authority, where those Wave 1 and Wave 2 changes took place. COVID-19 has been another significant event for all of our leadership to respond to. I would suggest that Manitobans always have a right to expect that their senior health leaders will be on the job. I believe it's reasonable for Manitobans to expect that, and I would ask you to address all questions pertaining to the absence of the CEO for St. Boniface Hospital at some points in time, to hospital, and to the St. Boniface Board.
Thank you, Minister, and this concludes today's media briefing.